Hello, my name is Dr. Arbeitman, and I want to thank you for clicking on this video. I have done this specific presentation, our advanced healing consultation, hundreds and hundreds of times over the last 17 years to virtually every new patient that started care in our office. And one of the things that I found clinically is that the patients who attended and obtained this information by far and away did better. They were here less, they spent less, and they got better results than those who did not. This had become an integral part of a patient's experience in our office, and I wanted to make this presentation available to all of you in the comfort of your own home. What I found early on in my career is that patients came in with certain belief systems about their body, about their health, and belief systems are really important when it comes to our health because whether we're aware of it or not, the actions and behaviors that we take for our health or that we don't take are based on what we believe. And some of those belief systems were installed by our health professionals, by our mothers and fathers, by people who taught us, the things that we hear on the news. And if we have a empowering belief system with respect to our health, it can do great good. But if we have a limiting belief with our health, and I'll give you an example, as I get older, I get sicker, or I must just be getting older. These are limiting beliefs that people have that really limit their body's ability to fully express itself. So in this consultation, we're going to be addressing some of the empowering beliefs that you can have in your life and your family's life. We're going to talk about exactly what your body will be going through or is going through as a patient in our office under upper cervical care. We're going to give you great strategies and also give you a better understanding of the work and how to communicate it to others. So let's dive in. I believe beyond a shadow of a doubt that we save lives with the upper cervical adjustment. And we're going to talk about that. And that may seem like a really bold statement to make. And I don't mean we save lives like an emergency room doctor where, God forbid, if there was an accident out there right now and somebody was thrown from the car, you're not going to rush them into my office. We're going to give them an adjustment and it's going to mend their arm that's hanging off their body. It's not emergency medicine. But what I have noticed through the years, over 200,000 adjustments later, is that oftentimes by the time people reach our office for care, they've been everywhere, they've tried everything, they've done everything, and they still haven't gotten an answer. And they sort of land here as a last resort. And people don't simply come into our office because they're in pain or discomfort, although that's one of the main reasons people call. It's because that pain and discomfort or problem is interfering with their ability to do something that they love. Something was taken away, some quality or piece of their life was taken away. And so we're going to talk about in a moment how the upper cervical work has restored lives. And that's how big this game is. But first, I want to give you a test. And this is what I call an awareness test. So hopefully you can see this from the comfort of your home. I'm going to just slip over here for a second.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13.
Did you get that? 13.
But did you see the moonwalking bear?
Ah. Let's look closely this time. Hopefully you can see that. I'll point to it. There's a bear here coming across the screen. Do a little dance. So it's really easy to miss something that you're not looking for. And in person, people are blown away. And you can look that video up on YouTube. But the main point is, lots of times there's something right in front of our face that we can't see until someone brings our attention to it. I mean, think about the chair that you're sitting in right now. A moment ago, you weren't thinking about the chair until I said, think about the chair that you're sitting in right now. And so some of the things that I'm going to point out tonight are going to seem so logical. You may even say, why didn't somebody ever point that out to me? And we refer to that as a moonwalking bear. So as I already mentioned, we oftentimes meet people at the end of their rope. And beyond a shadow of a doubt, if I could lend you my eyes to see what I've seen over the last 17 years, you'd be up here filming this presentation right now. And so many of our patients have become major advocates of the upper cervical work. They've screamed from the mountaintops. Well, now they do it on YouTube, Facebook, and Google. But we have patients that have sent dozens of people towards upper cervical care. I got here because someone told me about it. And so you may be that person too. And so early on in my career, I had a few cases that were completely life-changing. Because when you get out of school and you're a new practitioner, you hear about the miracles chiropractic care is famous for, but you still haven't seen any yet. And very quickly, I started to see some pretty amazing things happen. This was one of my early patients. Her name was Sarah. And Sarah was an athlete at a local high school, a local parochial school. And she was brought because she had a number of concussions and was dealing with headaches and migraines and was actually missing a lot of school. And we took care of Sarah for a while. That was about 10 years ago. And she, slowly but surely, she got well. She got so well that she went back to school, graduated from that parochial school, and ended up going down to Philadelphia to college at Drexel. She then would come home for her care, on the breaks to see mom and dad and do her laundry, and she'd pop in for an adjustment, and we took care of her all through college, and then she graduated college. And that alone is an amazing story. I mean, somebody that was basically missing school in her senior year of high school because of post-concussion syndrome, who got back to school and had a full college career. That alone is an amazing story, but it takes a twist. Sarah then gets a job in New York City, and she was under a lot of stress. So typically, if somebody's under a lot of stress and they go to their doctor, oftentimes they'll get prescribed some sort of antidepressant or medication. And I'm not a medical doctor, and I don't pretend to be a medical doctor, so I don't really know much about these medicines. I only know what I've kind of seen from a clinical perspective. And so one day I came out of my office and I saw, and this is like 10 years from when I first met Sarah. And this is a long period of time I'm talking about. And Sarah's sitting up in the reception area with her mother, Jane, and Jane hasn't driven Sarah to the office in years. And so I knew something wasn't right. And then I saw Sarah get up on a walker, and she skirted across the hallway on a walker, and my stomach just dropped to the floor. I mean, have known her, watched her grow up. I walk in the room and get down on a knee, and I sit down with her and I say, Sarah, what happened? And she goes on to tell me the story in more detail, that because she was under stress, she took a particular SSRI medication, and it had affected her brain, and her legs were flapping uncontrollably in front of me. And she couldn't walk, she had to move home. She tells her story and her recovery in this short little clip. Let's play this.
I'm Sarah Gursky. I'm a brand manager for Lean Fong.
What were your initial complaints?
I initially came to see Dr. Larry about 10 years ago because I was suffering from migraines. Then I improved after a few treatments and my migraines lessened. Then the past year I was suffering from anxiety and stress, which caused me to have tremors, which put me into the hospital. So after a month of hospitalization and being unable to walk, I came back to see Dr. Larry for treatments.
What did you do to try to help your problem that didn't work?
I went to the hospital. I went to 3 hospitals within a month period. I had spinal taps, EEGs done, but nothing seemed to help. It only made me worse with all the medicine I was on.
How did this problem affect your home, life, work, relationships, hobbies?
I had to quit my job. I was immobile. I could not walk nor feed myself for a while, nor did I have a life.
Nor did I have a life.
How do you feel now?
I now am able to run again, walk, and I do not have headaches currently either. And I hiked a volcano the past week.
Look at her light up.
Continuing wellness care to stay healthy.
So there are so many stories like this. I mean, hundreds and hundreds, if not more. In fact, you can go onto our website and you want to feel good about the care and what you're about to go through. Watch the testimonials and listen to the stories. But this is what I think about. What if Sarah didn't know about upper cervical care? This video was filmed 6 weeks after she got up on that walker. Her legs were flapping uncontrollably. It was an upper motor neuron lesion, meaning her brain was affected. And I said, Sarah, we're gonna do the same thing we've always done for you. We're gonna take some pressure off of your nervous system, specifically at the top of your neck, which controls your body, and we're gonna let your body do what it's gonna do. And I put her down on her side, and I do an adjustment, and her legs stopped flapping. And so within 6 weeks, she was off to a mission trip in Ecuador, and that's where she hiked the volcano. But what I think about is, if Sarah didn't know about this care, where would she be today? I mean, she had to move home with her mom. Her mom was feeding her. Would she ever get back to her life? Would she ever get back to her career? Would she ever start a family one day if that's what she wanted? And one of the things that motivates me to come in, no matter what's happening out in the outside world, is how many more Sarahs are out there that don't know about upper cervical care, and that they just got that adjustment, that their life would be changed. That's the driving force for myself and for my team. And so there's another way that we save lives, and this is a very serious conversation. One of the leading causes of death in America are opioid medications. According to the CDC's website, a rise in opioid overdose deaths in America, 399,000, let's just call it 400,000 Americans, 400,000 Americans have died from 1999 to 2017, an 18-year period. That is just unbelievably high number. The 1990s marked the rise in the prescription opioid overdose deaths. 2010, that decade, we started seeing more heroin overdose because it was getting easier to get heroin than it was to get the opioids. And then in 2013, fentanyl and tramadol, the synthetic opioids, start hitting the market. This is what I'm concerned about, is the prescription. I'm concerned about it all, but the prescription opioids that people died that were prescribed by their doctor, drugs that were prescribed by their doctor. 60,000 Americans died in Vietnam. We're talking about 400,000, about 7 times the amount of people that died in Vietnam. And these are mothers and fathers and grandparents and uncles and daughters and sons. And unfortunately, the problem had gotten so big that most of us know somebody who overdosed. Now, one of the things that I'm most proud of in our practice of hundreds and hundreds and hundreds of patients is we don't have any patients on opioid medications. In fact, the American Academy of Family Physicians, the medical organization, came out last year and said that professions like chiropractic, physical therapy, should be the portal of entry for people. Now, we don't take people off their medications. Well, I'm not a medical doctor. We have people that oftentimes come in on those medications and are able to get off of them once their body starts to heal. And then I think of the many, many spines that we take care of that have advanced degenerative changes. How many of those patients would have ended up on those medications or under surgery, and that we prevented? So we don't know how many lives have been saved in our office, but I believe it's many. And I wonder if how many of those 399,000 Americans knew of gentle, safe, specific upper cervical care, that they'd still be alive and here with us. So this talk may not just be for you. It may be for somebody that you know. You may have to click and share and copy this link and send it off to someone. It takes you 2 seconds, but it can save their life. So in 2017, more than 70,000 people, 70,000, think about that number right now. You know, we're hearing a lot of numbers about deaths in our country. 70,000 in 1 year died from opioid medications in the United States. 68% involved a prescription, and adults between 25 and 54 have the highest rates, and it's the number one cause of death for adults under 50 years old right now. Preventable. So, what is health? Typically, if I have a room full of people, and that's really the only way I've ever done this presentation, I'll ask everybody, and I'll ask you personally, how many people want to be healthy and happy? And everybody's hand goes up, and it's my way of connecting and getting everybody on the same page. But it's true now more than ever. People understand now how important their health is, how fragile it is, and for the first time in a long time, the consciousness is elevated that your health, my health, actually affects everybody around us. And the whole world is interconnected. It used to be like, it's my body, I'll do what I want. No. Your ability to stay healthy and stay well has an economic impact. It has an impact on our healthcare system, an impact on our hospitals, an impact on your family. We all have a duty and a responsibility. And so I believe in an empowerment model where we don't abdicate our responsibility for our health to someone else, that we actually take responsibility, because ultimately no doctor, no pill, no hospital, no surgery can fix you. You can fix you. Doctors, professionals, wellness professionals can help, can facilitate, and become a partner. In fact, the definition of healer is really the professional that's with the person at the time that they heal themselves. And so doctors don't heal people, people heal people. And so how do you know if you're healthy? Typically, if I ask a room full of people, how do you know if you're healthy? And I ask for an answer, I'll hear one of two things. Well, if I feel good. If I feel good, I'm healthy. And then other people will say, well, if I'm not sick, I'm healthy. And both of those really aren't true. It's kind of like a 13th floor in a building. You ever get in an elevator, you look at the control panel, and there's no 13? Why is that? Well, there's a superstition that a 13th floor in a building is unlucky and nobody's going to want to be on it. So grown men and women have designed and built these multi-million-dollar buildings without 13th floors because of a false belief or a superstition. And I will tell you, feeling good is it's a 13th floor. Now, don't mishear me. I want you to feel good. I want to feel good. I want my family to feel good, but it has nothing to do with your health. Think about this. Certain cancers, heart disease, diabetes, strokes, hypertension, osteoporosis, even a virus you could be carrying for 2 weeks. And all those people that I just named could feel good until the condition develops so far that now they feel bad, or they don't find out until they have a test and they get totally blown away that they have something that they need to be concerned about because they said, but I felt good. Because how you feel has very little to do with your health, because only 10% of what's going in your body actually reaches your consciousness. 90% of what's happening in your body is all below the level of your consciousness. Just like you can't tell me what your heart rhythm is in this moment or your respiratory rate. You need something to test that. And so we're sort of told at a very early age that when you feel good, you're healthy, and when you don't, you're not. And it goes back to when we used to see drug ads and drug commercials, and you'd see people running through the fields, without allergies. I think it may have been an Allegra or a Claritin commercial. And if we have these symptoms and we take this pill and the symptoms go away, we have our health restored. And the problem sometimes with the medications is that they work too well at covering up the symptom. So there's a false illusion that the body is now healthy. Of the 1 million Americans who will die of heart disease this year, they're not dying because they forgot to take their medication. They're dying on their medication. Oftentimes they're dying with good blood work, because the medications did such a good job at making their blood work appear to be normal that they never changed the way that they were living, and ultimately they succumbed to their heart disease. And so I'm not saying people should throw away their medications. I'm saying you need to earn the right to not need medications, and you need to make the necessary changes and work out a plan with your doctors to be able to reduce medications if at all possible at this point. So Dr. Larry, if health isn't how I feel, then what is it? Well, let's ask the dictionary. According to Dorland's Medical Dictionary, it's a complete state of mental, physical, and social well-being, and not merely the absence of disease and/or infirmity. So just not having disease or infirmity doesn't mean you're healthy. It's a complete state of mental, physical, and social well-being. And I've done this presentation thousands of times, and I've always asked people, how many people in here have a complete state of mental, physical, and social well-being? And I've never seen a hand go up except for like the wise guy. Because none of us have a complete state of mental, physical, and social well-being. In fact, I don't even think it's possible. I think it's a utopic definition with different levels, just like right now, our health status is greater than the people in the hospital, thank God. Could our health be at a higher level than it is right now? So it's not, of course it can. So it's not a destination, it's not an event. You don't become healthy. It's not a destination like now I'm healthy, but neither is illness. They're both processes. You don't all of a sudden become ill. That was a process in the making as well. So Webster is a great definition. It's a condition of wholeness in which all of the organs are functioning at 100% of the time. Look at this definition. A condition of wholeness in which all of the organs, which means you still have to have all your parts, maybe, the appendix was taken, or the tonsils were taken, or reproductive system, functioning at 100% of the time. You can't do anything about the time that's gone. The past is the past. But the actions and behaviors that we take today can greatly impact the future. So the key to this definition is function. When your body is doing what it's supposed to do, when it's supposed to do it, you have health. For example, if the thermostat is working inside this building and it gets really hot out there, the air conditioner kicks on and it keeps the internal environment constant. That's function. But if it gets really hot out there and the thermostat broke, it's not going to take very long for the temperature to rise and the condition within here to get really sweaty, hot, and muggy. And what we don't do, because we know it's not true, we don't go outside and go, it's getting hot in here, it must be getting hotter outside, and blame outside. We go, hey, can you check the thermostat and make sure the AC is on? But how come when our body goes off, we look to the outside for an answer, we don't look to the inside? Because we were trained that way. You don't ask the questions, well, why is my blood pressure going up but not coming down? Why is my sugar going up but not coming down? Why is my libido going down but not coming up? Why is my thyroid low but not high? Why isn't it doing what it's supposed to be doing? Because there are internal mechanisms within the body that when they're functioning properly, do what they're supposed to do when they're supposed to do it. So we're going to talk about those mechanisms in a moment, but here I want to give you tools. Because I believe oftentimes it's not enough for people to just show up for adjustments and not make any changes in their lifestyle on the outside of here. Now, what's awesome about upper cervical chiropractic is it is that powerful where people can just get adjusted and see dramatic changes in their life without changing anything. But I can tell you, if you're in the camp that gets adjusted and lives well and makes the healthy lifestyle changes, your results will be longer lasting and phenomenal. And so it is a partnership. The model of the doctor telling you what to do and you just showing up and doing it, that doesn't work. I'm only going to be with you a couple times a week in the beginning and less as time goes on. So I have to teach you or show you or empower you or inspire you to help yourself. And so if you look at the first 4 letters of health, it's heal. And ultimately, lots of people come into our practice because they want to heal. But you have to recognize that the body is a machine. It has this internal healing mechanism, and we can either feed it or starve that mechanism. Even patients who have conditions, let's say a virus, and they're in the hospital, the doctors can definitely help keep them comfortable while their body heals itself. So we have to start with nutrition. So many people believe that the way to keep the immune system well is simply to avoid people who may be sick and to wash our hands. And those are good preventative measures, but they don't build immunity. They're just avoidance or prevention. That's not wellness care. That's preventative. That's just prevention. And so when we look at nutrition, you have to realize that your food is your medicine. It's God's medicine to your body. And and this is just my theory, but one of the reasons why, well, it's not my theory because I just read a research article. One of the reasons why people are so affected by viruses in this country is because there's a higher link to mortality from a virus if you're obese. So the choices we make now can largely determine what would happen to us in the future should we need help, should we have an exposure to an infection, or if we have a pain syndrome that needs to heal. Nutrition can help the body get back into a state of homeostasis. And if you put the wrong things in, you're stressing, you're putting another layer of stress and demand on the body. But if you're putting the right thing in, you're nurturing it. And if you think about, if you had a brand new Ferrari, I don't even know what they are, I'm not a car guy, $250,000, $300,000 car, you wouldn't put junk gasoline into it. You would only put the best into it. There is nothing more valuable than this machine, and it does require certain nutrients. So we want to eat well, we want to eat clean. You want to shop the outside of the grocery store. Most of the things on the aisle with big words, more than 3 ingredients that you can't even pronounce, they're not food. They were made in a lab. They're chemistry. They're applied chemistry. Your body has to break all that down. You want to eat live foods that either came out of the earth, came off of a tree, or came off of an animal. That's how you want to eat. You want to hydrate. You probably see me, I keep going for my water. You know when you're so thirsty and the water tastes so good? But the thing that happens with hydration is every process of your body requires water to operate. So if you're in pain and if you're tired, there's a good chronically fatigued, there's a good chance that you're dehydrated. So start right there with hydration. You want the water constantly coming in and out. And this is what happens. If you're not a water drinker, you actually become less thirsty, meaning your thirst receptors get desensitized and you don't even crave it. It's those of us that drink a lot of water that are always feeling like we need more water. And this is why dehydration is so rampant in seniors, because their thirst receptors desensitize and then they stop drinking, and then before you know it, you're dehydrated. Your body will bring water away from your skeletal muscles into your vital organs. And your muscles will start to get tight and ropey because the water is much more needed inside the organs and the cavity than out in the muscles. So start drinking more water. There's some supplementation that I think is important, especially for our patients who are first starting out care. If you have neurological condition, if you have inflammation, omega-3 is a really important supplement. This is fish oil or flaxseed oil. You can't eat enough salmon in a week to get what you need. And what we know is omega-6, the other kind of fatty acid, tends to be very inflammatory and high in the American diet. Omega-3 tends to be very low. And what the research shows is that when you have a high omega-6 to omega-3 ratio in your diet, you're going to be more prone to cardiovascular disease, dementia, inflammation. So this is such an important supplement for inflammation and also neurological function that we've been giving it to our children. I love a brand called Carlson's. They have a lemon flavored for children. We use Metagenics here in the office. We keep these here in the office. This is what I personally take. And you can talk to your doctor, your pediatrician, or myself about what would be appropriate for you or your children. Vitamin D is a very important one too for your immune system. It's a pre-hormone, precursor to hormones. Our body makes it from the sun. In the Northeast during the winter months, the vitamin D levels are definitely rock bottom in people's bodies. It's such an inexpensive supplement. I like doing it in this little dropper form. I take 10,000 IUs per day. I give my children 5, but again, talk to your pediatrician or us. And I use vitamin D. I like a good multivitamin and mineral. Magnesium, if you have muscle tension, tightness, spasm, it's good to take that before bed. That can help relax the muscles. But again, with the omega-3, that's probably the single most important. But if you're on blood thinners or you have a medical condition, definitely consult with us or your doctor. So moving along here, sleep. If you think about it, sleep is the time of day that the body actually restores and renews itself. If you've ever forget to charge your cell phone at night, you know that by 11 o'clock, 1 o'clock, it's dead and you're asking somebody for a charger. If we're not getting adequate sleep night in, night out, it becomes catabolic. It starts to break the body down, and we know it. We know it. And then we tend to get sick. I mean, you run yourself ragged. You burn the candle at both ends. So we want to make sleep sacred, which basically means you want to have a set time that you go to sleep at the same time every night without fail. You want to have a 20 to 30 minute bubble, meaning where you separate your day from your sleep, some sort of downtime, and that doesn't mean iPhone or computer or news, because that's going to put you basically in a frazzled state going to sleep, and all those thoughts are going to circulate in your mind. The good activities before bed would be to do some stretching, maybe some yoga, read a book, have a conversation with your spouse or your partner. Just try to mellow it out. Don't go right from the laptop to the bed. Having the right equipment for sleep is important too. A lot of patients ask me what pillow I recommend. Look, the truth is there's not going to be one thing for everybody, but I will tell you I've been recommending this pillow, this Tempur-Pedic cervical pillow, for virtually my entire career, and it works for 80 to 90% of the people that use it. What a lot of people found is that nobody ever taught them how to use it or sized them up for the right size pillow. If you remember when we took your x-rays, a lot of people were losing the curvature in their neck. And so what I like about this pillow is it has this thick part, I call it the boulder, and it goes down on the shoulder and allows the head to fall back and into the hole. It's a very firm material, which is supportive for the neck, and it doesn't collapse. If you think about those pillows in the hotels that you kind of have to bunch up, they feel really good when your head hits them, like, oh, they're so soft. But like halfway through the night or 20 minutes in, you're kind of doing this thing to kind of build it back up, and you're wondering why your hand is tingling. So that's why I like these pillows. You don't get that aha feeling because they're firm, but they're the mattress for your neck. And it's going to keep your neck from collapsing. I just saw a patient today. He said, my hands go numb at night. I said, you're not, he's a big guy. I said, Daryl, you're not getting the support. So you want to make sure that your neck and your shoulders are staying at a right angle. On your side, these pillows work really great. You take that boulder and you get it all the way down against the trap there, and your head into the hole, and that keeps everything at a right angle. They make this in small, medium, and large. So based on your body frame, we size you and fit you and make a recommendation. Make sure you have a good mattress. I mean, if your mattress is hammocking like it belongs in the Bahamas, it's time for a new mattress. You can flip them, rotate them, but generally over 10 years, I mean, it's time for a new mattress. So it's funny how people are in our society. They will spend $40, $50, $60, $70,000 on a vehicle that they may be in 90 minutes a day, an hour a day, but they balk at spending $25,000, $3,000, $4,000 for a mattress that's going to give their body the restorative sleep that it needs. Positive mental attitude. Most people will agree that your thoughts impact your body. Most people are not going to walk around telling people they have cancer when they don't. It works the other way too. We can actually empower our body to help itself. So I've noticed this very early on in my career that I can almost predict what patients are going to do well and not do well. This patient that goes, it's not working yet, I've been here 2 times, doesn't do as well as the person that goes, whatever it takes, let's do this. I'm in partnership, I'm all in, doc, just tell me what we need to do. That person always does better. So make sure that you're approaching everything in your life, but specifically your chiropractic care, with a great positive expectation that there's going to be an amazing outcome. And be careful, especially now more than ever, be careful who you talk to about your health. You have to have a filter on your mind to, when it comes to your health, what you're going to allow in to your psychology. And this is why I always encourage spouses to come and hear the information with patients or parents or partners, because the research shows that when a person feels supported, their outcomes, their health outcomes, go up exponentially. Meditation's a great way, and especially now, we need ways to unplug and protect our mind. Meditation is one of the most powerful tools that you can do, and it's a practice. You have to learn it. You can start with a guided meditation. There's a lot of apps on the phone like Headspace and Calm. There's others now. Transcendental meditation, known as TM, is a great tool. Just taking time to do some breathing exercises every day. But there's tons of stuff on your phone that you can just listen to. It's about quieting the mind and the chatter and the monkey brain, all those monkeys jumping around in the brain. That will help the body heal for sure. Proper movement and exercise. So you would think that if we were sitting around in our home a lot and watching Netflix, that we'd be conserving energy, and so we'd have a lot of energy on Monday. But that actually makes you less energetic and more lethargic. Why is that? Because the most important nutrient for your central nervous system, for your brain, is movement. When we're moving, we get more energy. In fact, right now, if you've been listening to me for 20 minutes, I would say hit pause, get out of your chair, stretch out, do a few jumping jacks, bend to the left, bend to the right, walk around, and then sit back down so you're energized for the rest of this talk. Your body is like a power plant. A power plant doesn't have energy, it generates energy. So if you're saying, oh, I'm so tired and fatigued, that's why I don't work out. No, you're not supposed to have energy until you generate it. When you work out, you generate more energy and more energy and more energy and more energy. I have more energy than you right now because I've been moving and I'm animated. So you want to incorporate movement into your body, into your day. Now everybody is at a different health level, and we have specific support exercises which I will provide you, or the other doctors will provide you on your visits, so that you can stretch and strengthen your spine. We have tons of videos, not tons, we have videos on YouTube of me doing simple stretches, strengthening upper body, lower body, core, postural exercises. Check those out. Check those out. I like a program called Foundation Training. This was developed by a chiropractor, and I teach some of these in the videos I have on our YouTube channel, Upper Cervical Chiropractic in Monmouth. But basically, we're all collapsing down in the front. And if the front of the body gets tight and the back of the body gets weak, you get this posture. Foundation Training is a program that's designed to strengthen the posterior chain of muscles, which runs from here to here, and open the front of the body. And I just found that patients who do our exercises or foundation training or even basic yoga or Pilates in conjunction with their chiropractic care do much better, much quicker. And ultimately, that's how you're going to stabilize and help yourself for the long term, right? You need to be able to strengthen this thing. And we're happy to speak to you specifically about exercises for you. And I got to tell you, I've taken care of many professional athletes, college athletes, high school athletes who are doing all four of these things right. They got the nutrition, the sleep, the attitude, the tons of working out and training, but they're having health issues or healing issues or chronic injury or fatigue issues. And it's because they're missing the fifth pillar of health, which is proper nerve supply, which we're going to talk about now. So I'm going to teach you chiropractic here. And to many of you, that looks like 7th grade health class. That is an egg and a sperm, and they come together and they start to divide. Now, what does that have to do with chiropractic? There's an intelligence within those two cells encoded there. Those are two microscopic cells that you can't even see with the naked eye, yet it has all the intelligence to make you and I. That's miraculous in itself. And that intelligence comes together and it starts to divide into cells, 2 cells and 4 cells and 8 cells and 16 cells. And if you ever saw a fetal ultrasound, you would see that it looks like a comma. And that comma, here it looks like a lollipop, is the neural streak. The neural streak is the first thing that forms embryologically, and that's going to become the brain and the spinal cord, or the central nervous system, and that's going to run the growth and development of every organ, cell, and tissue for that embryo as it develops into a fetus. And then they usually bring mom and dad back around 20 weeks and they do another scan, and then they start to measure the size of the organs, because it's the nervous system that is going to develop the respiratory system and the cardiovascular system and the stomach and the liver and the spleen and the bladder and the kidneys. And then God or nature, whatever you believe in, so intelligent. It's intelligent. This is an intelligent process. That the nervous system is the only system in the body that's encased in bone. Your skull protects your brain, and your spine protects your spinal cord, which is truly your mind-body connection. You interfere with the spinal cord, you interfere with the body, the brain's ability to talk to the body, and the body's ability to talk to the brain. And the next most important organs are protected by the rib cage. And then you get a little boy. And so from those two microscopic cells, from the intelligence within those cells, this young man is made. And so if you think about that, we have different levels of intelligence. We have educated intelligence, which is all the information and knowledge and research that we know collectively as human beings. We have the innate intelligence of the body that knows how to do this, or knows how to tell your heart to beat, or your lungs to breathe, or your stomach to stomach. And then we have the universal intelligence of the universe. Basically, how does the globe spin? And how do the birds know to come back from Florida every April? How do the waves continue to propagate themselves? There's a universal intelligence. And I got to tell you, we know very little about that. So we as a society put educated intelligence up here, and we put innate intelligence here, the body's ability to take care of itself, and universal intelligence down here, when the truth is, it should all be flip-flopped. Because educated intelligence is probably this much compared to what we know about the body or the universe. And so that's actually an image of a developing embryo, and you can see the spine developing, and these are all the nerves. This is the central nervous system. Now after that baby's born, it doesn't stop. That nervous system's gonna run the life of that person. So I'm going to teach you chiropractic here quite simply. This is how your nervous system works. So your brain, in any given moment of the day, is sending down messages from your brain down your spinal cord to every different organ system of the body, to your heart, your lungs, your liver, your spleen, your bladder. Now, what's the one place that all these messages have to pass through? When I have a live audience, they usually say, oh, my spine, they pass through my spine. They do pass through the spine, but more specifically, they pass through the upper spine. Every single message, the one that goes down to the bladder, or the one that goes out to the kidneys, or the one that goes to the heart, has to pass through the upper neck. That is your mind-body connection. That is your lifeline. So if something was interfering with the messages in the upper neck, would we be healthier or sicker? We'd be sicker. And not only is the body sending messages, the brain sending messages down to the body, and it's trillions of messages per second. The body is also constantly sending information up to the brain. A lot of people think the brain is telling the body what to do, but the brain is actually a receiver. It's receiving more information, making determinations, and then sending that information back down. And if there's any interference in that process, it's going to result in lack of ease in the body, lack of function, eventually dis-ease, and then disease, and then symptoms. That's the process. That's the process. So all problems are problems of communication in a relationship, in a family, in a nation, in a world, and definitely in the body. If you interrupt with the communication process, your body is not going to work the way that it once did. And people go, I must be getting older. Nothing to do with getting older. There's a perfect example of blocked communication in the upper neck. So Superman, this tragedy, he had an injury at his second cervical level of the spinal cord, and he didn't just develop headaches and neck pain, Christopher Reeves. He lost the ability to walk. He lost the ability to breathe for himself. He lost his life much earlier than he should have in this tragic accident, because that life force was blocked or severed or interfered with. Now, what if you or someone you loved had nerve interference at the same level in the upper neck as Christopher Reeves, but to 1/10 of a degree or 1/100th of a degree? Could it affect your legs, your heart, your lungs, your blood pressure, your spleen? Of course. And what doctor actually looks for nerve interference in the upper neck? Not your primary, not your neurologist, not your orthopedic, upper cervical doctor. And this is why there is a select group of upper cervical doctors we've devoted our entire career to understanding the mechanics of the upper neck. This is what the upper neck looks like, and how to correct it. So your central nerve, your body is self-healing and self-regulating. If you've ever cut your hand, what made new skin? The Band-Aid? No. The Neosporin? No. Your body makes new skin. If you break a bone, even if the doctor has to put the bone back together, then you have to go in a cast because the body has to heal that bone. Even if, God forbid, someone you know or loved had brain surgery, the surgeon then comes out and goes, the surgery went well, now we have to see how she heals. Even a person that goes into a hospital with a bad infection, it's ultimately, again, the body that's going to heal that infection. Sometimes the body needs some help. Sometimes it needs an adjustment or some other kind of intervention or therapy. And then we step back and we watch for it to heal. And it's the central nervous system that is responsible for all the healing and self-regulation of the body. And as I already mentioned, if something was interfering with your nervous system, would you be healthier or sicker? Sicker. Would you heal as well or not as well? Not as well. As a chiropractor, we remove nerve interference, period. Yes, people come to us with headaches. Yes, they come to us with migraines. Yes, they come to us with vertigo. Yes, they come to us with fibromyalgia. Yes, they come to us with vestibular issues. Yes, they come to us with disc problems and nerve problems and sciatica and back pain and neck pain. And yes, all of those things have gotten better in our office, not because we do different treatments for all those things, because we remove the pressure to the nervous system so the body can start the healing and mending process, period. It seems really simple to do and to explain, but it's not simple to pull off. It takes a career and a lifetime to learn how to do it effectively. And it's something we're really good at here. So when's the most common time we injure our nervous system? When we're born. What does being born have to do with hurting our nervous system? Most people think it's like car accidents or sports injuries. Well, the birthing process in itself can be very traumatic. Just to get the baby out at a normal vaginal birth can be a 180-degree turn of the neck to clear the second shoulder. Sometimes they have to use suction. Sometimes they have to use forceps. And a cesarean section can apply 60 pounds of axial traction on the upper neck. That's equivalent to taking a plate, weights, 60 pounds of weights, tying it to a baby's ankles and pulling up by his or her neck till the weight was off the ground. So I am not saying that obstetricians are bad people hurting babies. Don't mishear me. All I'm saying is the process can be very traumatic. And the World Health Organization says that only 10% of births should be cesarean when medically necessary to save the baby or the mother's life. In America, we're well over 30%, projected to go to 50% of cesarean sections. And I believe this is one of the times where we all had our first misalignment. Because if you think about it, if you ever held a newborn, what do you say? Hold the head, hold the head, hold the head, because the head's all floppy. Floppy, there's no muscle strength yet. And this is how we're pulling them out. If I did that to your neck, you wouldn't come back for your next visit. And so when we look at even like a cesarean section here, here's mine.
Getting irritated.
It's a normal cesarean section.
Oh, there you go. Oh.
Come on, buddy.
All right.
Ears of a girl. Ears of a girl.
Make it cute for the camera.
Oh, yeah. Keep coming back with this show.
There you go.
All right. Look at those big old testicles.
That's a lot of force. That's a lot of force on the baby's neck. And so that is the moonwalking bear. Because we don't realize, many of you, when you saw your x-rays, and I said, yeah, it looks like that arthritis, the degeneration is about 20, 30 years in the making. You're like, but I never had an accident. But you were born. Think about, if you've had children, how much they fall in a week, in a day, falling off of swing sets and the ottoman and the couch. Think about the backpacks. Think about when you got up on the airplane and you banged your head on the overhead. Think about when you stepped off the curb and that jolt went up your body, or you hit your head on the door jamb, or you're looking at your cell phone hours and hours a week, or your technology, or your sports injuries, or the car accidents. It's amazing what we put the body through physically. And so the cesarean, according to the Journal of Pediatrics, January 2015, they looked at 2 million children born by cesarean section in a 35-year period. That's the largest study I've ever seen to this day. They looked at 2 million cesarean babies, and what they found in the Journal of Pediatrics, which is probably the most prestigious medical journal for pediatrics, children delivered by C-section had significantly increased risk of asthma, systemic connective tissue disease, juvenile arthritis, inflammatory bowel disease, immune deficiencies, and leukemia, blood cancer. Cesarean delivery exemplifies a shared environmental risk factor in early life associated with several chronic immune diseases, and the mechanism remains unknown. All I'm saying is that these babies, once they are born and their APGAR is strong and they go skin to skin with mom and they learn to latch, that they should be checked by a competent chiropractor who's trained in checking children, or has experience checking children. And it's so gentle that if a baby needs an adjustment to take the pressure off of their brain stem, because this nervous system was just running their growth and development for the last 10 months inside mom, it doesn't stop now that the baby's born. And that misalignment, when's the best time to stake a tree? When it's growing, not after it's all grown and crooked and gnarly, right? And so pediatric chiropractic is really, really important. 1 in 11 children, this is the sickest generation of children. Sickest generation of children. Look at these stats. According to the CDC, 1 in 11 children have asthma. We spend $50 billion as a society per year to maintain it. Not to cure it, to maintain it. ADHD, 1 in 8 boys according to the CDC. Most common drug prescribed is in the same class as cocaine or amphetamine. Fatty liver disease, New York Times article, 1 in 10 children are now that toxic that they're showing fatty changes in their liver. These statistics are probably already changed. Autism, 1 in 42 boys. I think in New Jersey now it's 1 in 28 boys. It's an unbelievable amount of children who are now autistic. 1 in 5 children, according to the CDC, have a mental health diagnosis. These are all children that could be helped with neurological, brain-based, upper cervical chiropractic care. And it's really no different than taking a child to the dentist, right? As soon as our children pop teeth, we run them off to the pediatric dentist. And I even joked with my wife when she took my children to the dentist that, honey, they don't keep those teeth. They're going to get a new set. And we laugh about that, but you don't get a new spine. They get one spine. And it's such an amazing connection to be able to take care of a baby and remove any nerve interference to that baby so that we can help that baby's immune system, digestive system, spinal development, growth development. It's the best gift we can give them. Imagine if our parents took us to the chiropractor when we were little. So we take care of lots of babies and kids, and depending on the time of day, you'll see them running around the office. So this is how your care is actually working, or going to work. So when the body has proper spinal alignment, we have a saying around here that structure dictates function. Meaning, if you change the structure of a car, let's say you bend the frame, it's not going to drive straight. If you change the structure of an artery, atherosclerosis, the blood's not going to flow through there correctly. If you change the structure of a cell, it's called a tumor. If you change the structure of your body, it's not going to function as well. It's going to lead to a state of nerve interference, malfunctioning tissues, dis-ease, not disease, dis-ease, and then symptoms show up. The medical profession are experts in diagnosing, testing, naming, and treating, And thankfully, we have some really great medical doctors who really care about helping people. But what we're saying is there's a process that comes way above and before this. And as a chiropractor, we're the only primary care physician licensed and trained to detect the misalignment that interferes with the nervous system, known as a subluxation. Now that may be a new word for you, but subluxation, sub means less, lux means light, less light in the body. Now subluxation may be a new word for you, but it's really just a chiropractic $10 word for stress. Does anybody on the other side of that monitor have stress? Of course, now more than ever, it's huge. Stress comes in three forms. There's physical stress, mental stress, mental or emotional stress, and chemical stress. And I always joke, like, look, nobody has any chemical stress because we all live in New Jersey, breathe the clean New Jersey air, drink the clean New Jersey water, and we're never exposed to any chemicals, insecticides, or pesticides. Physical stress. None of us have physical stress because we all work out 6 days a week, have a trainer named Rolf, and have a Pilates reformer in our living room. And we never sit at computers or desks in poor positions or look down at our phone like this. Emotional stress. Are you married? Do you have kids? Do you care about someone who's not doing well right now? Do you watch the news? Do you listen to the news? These are all things that claw at our nervous system. And what's amazing about the nervous system is it was given to us to be able to adapt. And it's amazing that we even get this far, but it's our nervous system that processes all this stress. And what happens is that stress deposits in the body, and it could put the body into a state of fight or flight. Now, fight or flight part of the nervous system, called the sympathetic nervous system, is really important. And it was given to us because our ancestors, they didn't have mortgages and financial stress and worry about infections and all these other things that people may be stressed out in modern life. They had tigers, lions, and bears. And so if I was a caveman coming along with my club and I saw a bear, my sympathetic nervous system would kick on and my heart rate would go up, my blood pressure would go up, my sugar would go into my bloodstream, my cholesterol would go into my bloodstream, my muscles would tighten, my memory would get short, my digestive system would slow down, my immune system would get suppressed, because I don't need my immune system and digestive system when I'm facing a bear, but I do need heart rhythm, I need sugar, I need cholesterol, I need focus, I need muscles to tighten, and I need to either be able to fight that bear or run. And then after that fight or after that escape, if I survived, then the sympathetic nervous system shuts off and the parasympathetic, where we heal, grow, and repair, kicks on. And that's the way it's supposed to work, inverse of each other. But what's happening now in modern society, now more than ever, people are running in chronic sympathetic fight or flight stress. And that left unchecked leads to chronic illness. According to the CDC, over 90% of our chronic illnesses are from unchecked stress. And that will lead to, think about it, more sugar in the bloodstream, diabetes, higher blood pressure, heart arrhythmias, muscle spasms, fibromyalgia, digestive issues, autoimmune issues are all normal adaptive stress physiology, but it's not supposed to be, they're not supposed to be a bear in front of you week in, week out, month in, month out, year in, year out. And we may not be able to get rid of the bear in our life, but we can improve our body's ability to adapt to that bear metaphor. And the upper cervical adjustment is one of the safest, gentlest, and most effective ways of shutting off the fight or flight response and turning on the feed or breathe, heal, digest, parasympathetic response. Parasympathetic, think of a parachute. And the parasympathetic nervous system is located in the upper neck. So every time you get your upper neck adjusted, it's literally like hitting the brake pedal on the central nervous system. And that's why the care has been so good for people with panic attacks and anxiety and blood pressure and ADHD and those type of stimulated conditions. So structurally, the upper cervical work is very, very unique. We choose not to crack, pop, or twist the spine, because the way that we look at the spine is it's not that it's a bone out of place. The spine was built as a column to withstand the forces of gravity. Gravity is 2,000 pounds per second pushing down on your spinal column. And when the spine is straight, it can withhold that. But if we have an injury in high school football where we get hit this way, our body may go this way. It may come back or it may stay there. And it may do this to compensate. Because usually you don't walk around crooked, the body will do something to compensate. And then we have another injury in our life. And then there's gravity. And there's all those things that I was talking about before that can throw the spine off. And what happens is, like a can of Pepsi or a can of Coke, if that can is straight, you cannot collapse that can. I don't care how strong you are. But the second you put a little twist into the can, the whole thing compresses and collapses. And there's different levels, right? Like this can is pretty crushed, but it can go further, and it can go further, and it can also get pulled out. And so what happens is we have accidents or injuries, and it shows up as a high or low shoulder, a high or low hip, and a twisting of the body, like a Pepsi can. And I can look at somebody from behind, and I can tell you the story of their trauma and how the body is compensated. And I've looked at thousands and thousands of postures and spines, and they can misalign in thousands of different arrangements. And typically when we have this misalignment, let's just say it's this, when we have this first misalignment, lots of times there's no symptoms. Remember how we talked about how you feel isn't everything? And so you could be walking around with this and you go, I feel fine, I'm good. You should go see my chiropractor. No, I'm good, I feel fine. And you walk around in this altered position, and it leads to altered mechanics, progressive wear and tear. Then something starts to hurt. Maybe you rub some icy hot on it, or take a pill, or put some ice on it, and it goes away, and you go on living because you never actually found what was causing that. And then the symptom returns, and then this time it doesn't go away. So you call a doctor, you go to the bone doctor, you go to the orthopedic, and the orthopedic takes an x-ray of a part. Maybe it's a knee, maybe it's a hip, maybe it's a low back, maybe it's a neck. But they never look at the whole thing because they're not interested in evaluating or understanding how one part relates to the other. We're the only doctor I'm sure you've seen that has taken the entire spinal column, because I know that you can't correct the neck without understanding what's happening in the lower back and hips, vice versa. It's all interconnected. And so when they take that MRI or that x-ray, they go, oh, there's your problem, sir. You have a disc herniation or arthritis at L5. And they go, but don't worry, it's part of the normal aging process. And you're smart enough to say, well, doc, how old is L4? It doesn't have any arthritis. Or you need a right knee replacement. You're getting older. Well, how old is the left knee? I don't need one there. Because it has nothing to do with aging. It's all altered mechanics and progressive wear and tear. And the only way that you're going to correct that is to go back to the beginning, where analyzing and understanding, okay, there was a trauma that then caused the spine to collapse, compensate, and compress. I've got to go back to that initial trauma for that person and drive that out of their spinal column if we're ever going to get this thing stabilized. And so which spine do you want? I mean, this one is obviously more healthy than this one. Which bone's out of place here? They're all out of place. Is that person going to have a straight spine again? Probably not. But here's what happens. This thing is so unstable now. Imagine the column in your basement, if it was all bent and twisted, the house would start to collapse in on itself. And so we can take a new patient that may look like this, and with the work that we do, start to decompress. And is this Coke can better than this Coke can? 100%. Now, what if we didn't do that? This Coke can is going to go further because you can't get away from gravity. It's 2,000 pounds of force per second on the body. So we're the only chiropractic technique that I know of that analyzes the spine and actually decompresses with the adjustment, drives out the compressive misalignment, and we do that through the cervical spine, various attachment points. And the reason we work through the cervical spine is for two reasons. The nerves in the upper neck, as I already pointed out a couple times, control everything below. If you take pressure off the nervous system in the upper neck, you can actually change the postural muscles in the lower part of the body. Think of Christopher Reeves. He didn't injure his legs, he injured his neck, and his legs didn't work. If you correct this, you can change the muscle tone in the lower half of the body. The other piece of this is you have something in your body called fascia. Fascia is like the saran wrap that goes through all the different muscles of the body. If you've ever peeled apart a turkey or on Thanksgiving, the fascia is that thin layer between the skin and the muscle. And fascia actually has a nervous system in it, and it communicates, and it's alive, and it connects here and here, at the base of the skull and at the tailbone. And if that fascia gets bent, torqued, and twisted, it gets shortened. And just like if you ever pulled up the blinds and one side goes up and one side doesn't, you know which side is tighter and needs to be released. And I can look at you from behind and go, oh, this thing needs to be released here. And so we're not pushing into the system. It's already compressing and collapsing. We want to release it, boom, release it, boom, so that it comes up. And this is why a lot of patients, after they get their adjustment, one of the first things they say is, I feel up, I feel open, I feel up, not collapsed. And I also know when there's a period of time where they're going without care, they come back and they go, I just feel like squished and squashed, and someone's sitting on me. And so that's what makes the procedure that we do in this office so unique. It's our understanding of the biomechanics, the way that we look at the entire body, that we don't push into the system, that we release it. And the technique, the broader name of the technique is upper cervical care, but it's really called Quantum Spinal Mechanics 3, QSM3. And so there's a process. So if you spend your time in your life in that compressed position and it leads to that abnormal movement is going to lead to a progressive wear and tear. And it takes about 15 years, 10 to 15 years for phase 1 spinal arthritis to even show up on an x-ray. You just don't see it in the beginning. By the time you have phase 2, which is the disc, the soft pad between the bones thinning and bone spurs growing, pinching the nerve that comes out, that's about 20 years in the making. And probably only about another 2 to 5 years till you actually have that gnarly bone-on-bone, bone spur stenosis. Now, it doesn't mean it's too late. It's never too late to take pressure off of the central nervous system, because you don't have to fix the bone. You gotta relieve the nerve, and the nerve can be relieved. And so that's what that process looks like. When's the best time to intervene? Here. Not here. Now, can we help seniors? 100%. Love taking care of our seniors. We have so many seniors. In fact, I have so many patients at this point that I've taken care of for 10 or 15 years, and I've x-rayed them at different intervals, 3 years, 5 years, 10 years, and we can see, we can't reverse this process, although I have seen bone spurs get smaller in some cases and spaces open up, but we can certainly slow down, stop, and arrest this process, so that if I were to take an x-ray of a patient 10 years from now, and they've been taking care of their spine over that period of time properly, that we should see, it shouldn't be, oh, you're getting older, so it's just getting worse. No, we should see that it stays, that it stabilizes. And that's really gonna provide long-term function and health and activity, high activity levels. And there probably should be, the best time to intervene is actually before that, when he was a little baby and the spine was growing and developing. So it's a gentle adjustment through the top of the neck. I'm 180 pounds, and these little bones at the top of the neck, they weigh ounces. So it's a really unique area of the spine. The first vertebrae in the neck is called the atlas. It sits on top of the axis, and so it spins on the axis. That's what that bony prominence is. And that allows us to turn our head 180 degrees. And then the skull sits on top of the atlas. The atlas is named after the Greek god that held up the world. It holds up your world. And if the skull tilts or twists on top of the atlas, it comes as a double-edged sword. The atlas is unique because there's no disc above it or below it. It doesn't have the funny interlocking joints like all the rest of the spine. And so that's what allows for all that movement. But because it can move so much, and because it's only held in place by soft tissue, it's the easiest, first, and quickest to become misaligned because it can move so much. So again, think of the birthing process, think of the baby, think of all the head injuries in life, think of all the stress that builds up back here. And if that misaligns, it's going to irritate the brainstem, the nerves, and it can affect anything in the body. The eyes, the ears, the nose, the throat, the arms, the heart, the lungs, the digestive system, the blood pressure, the back, fibromyalgia, trigeminal neuralgia, migraines, lower back pain, herniated disc, pinched nerves, all can be affected by upper cervical care, taking pressure off the upper neck to affect the entire column below. And because I'm 180 pounds and these little bones weigh ounces, it doesn't take a lot of force to adjust them or to move them. We use leverage instead of force, so we'll never crack, pop, and twist the spine. We don't do that. I'm 180 pounds, and if these bones weigh 12 ounces, it doesn't take a lot of force, but we do have to be on the correct angle to gain leverage to release this. The same way you can lift a car with one hand if you have a jack or a lever. So it's leverage mechanics and force rather than brute force. And it's just a gentle light touch at the top of the neck. And so there's different phases to care. The first phase is what most patients want when they first go to a doctor, which is relief. And we want that for you. That first phase of care, we typically will see you more often, and that's your initial intensive phase. And there's going to be a point where patients are doing better, and if they were to stop there, even though we celebrate they're doing better, if they stop when the symptoms go away, typically they're not stable enough, and in an amount of time, it could be a week, it could be a month, it could be 6 months, the symptoms start to come back because nothing was ever fixed. There was just sort of treating the symptom type of care. And so the second phase of care, which is probably the most important, is stabilization care. That's the care after you're feeling better that allows us to strengthen and stabilize the mechanics of the spine so you heal, so you recover, so there's changes happening. It's a recovery versus relief. It's no different than, when your friend's walking around with a boot on her foot that she got from the podiatrist, and she goes, the doctor said I got to wear this boot for 3 more weeks. It doesn't even hurt me anymore. Why? Because the fracture, even though it's no longer symptomatic, the inflammation has gone down, the bone hasn't stabilized. So if they were to take that boot off, they risk it fracturing again. And it's no different with the spine. People will get relief, but until the body is in a stable position and we can teach you how to maintain it for long periods of time, you run the risk of it just collapsing back down on you. And so that's why stabilization care is so important. And one of the things I'm most proud of is just the amount of maintenance patients we have in our practice. I'd say about 80 to 90% of the people we take care of at this point in my career have gone through initial care, through stabilization care, and they're using the care on a maintenance basis. Look, if you went to the gym for a year, lost 20 pounds, got in the best shape of your life, got a stellar diet, great muscles, lean and mean, and then you stopped working out and eating well, how long would it take for you to lose those gains? It wouldn't take very long. In fact, you'd probably start to lose those gains in a matter of weeks. And so most of the patients we care for have already permanent changes in their spine. And even though they've healed, they feel better, and their spine is stabilized, their body is still subjected to everyday stressors. And that continual maintenance care, tap, 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 allows their body to stay strong and grow stronger and not crash and burn, not wait until it falls apart again. And there's going to be less care, less money spent, less suffering with maintenance care than going through care, spending $10,000 on a new set of teeth. They're all white, straight, pearly, and then you don't maintain them. How long would it take for them to be black, brown, and crooked again? So you've got to maintain your spine. You only get one, and this is truly the best way to use chiropractic. It's just the way that you stay healthy. It's to continually do the things that your body needs on a continual basis. And it's a lot less care and suffering over the course of the life. So consistency is key. One of the reasons why we're so adamant about your schedule of care is because what we know is patients who miss appointments don't do as well. It's kind of like if you're saving, and then you stop for a couple months, you're going to end up in a totally different place a couple years down the road. Same thing with this care. Every visit that's missed, you end up changing the trajectory of where you could have been. And so every visit builds on the one before, and your consistency is key. So I want to show you this video about the power of the upper cervical adjustment. Dr. Raymond Damadian is the medical doctor that invented the MRI unit. He invented a new MRI several years ago called Phonar. It's more of a video MRI where we can see the flow of the cerebral spinal fluid, the fluid that comes in and out of the brain, come in and out, in and out, in and out. And he started working with an upper cervical doctor in upstate New York. And they started putting MS patients, Parkinson's patients, patients with ALS, ex-NFL football players into the Phonar machine. And what he found, and this isn't a junk scientist, this is the inventor of the MRI unit. He is the Thomas Edison of medicine right now. And If there's a misalignment in the upper neck, what they found is it blocks the flow of the cerebral spinal fluid that cleans the brain out. And he came out at a symposium in New York City to a group of neurologists, Damadian did, and said the underlying cause of MS, Parkinson's, ALS, and these neurodegenerative diseases is an uncorrected cervical trauma. And get this, on average, there's 11 years between the trauma and the first symptom, and that's why a lot of people are missing it. And if you remember back to your consultation, I dug deep to find out what your past physical traumas to your body were. I'm going to show you this video because I was thumbing through the channels one day, and on ESPN, they did a 30 for 30 documentary on Jim McMahon, who was the quarterback for the 1985 Super Bowl champion Bears in the era where the quarterbacks were just getting hammered. And he talks about the effect that the care has had on his own personal challenges with post-concussion syndromes. So I'm going to play this for you, and you can find this on YouTube too if you want to revisit it.
We were with Dave maybe 3 months before he killed himself. And to me, it was the same old Dave, whether he was a little more quiet than he usually is. He talked to me, but he said, Maggie, it was frustrating to get in my car to go pick up my kids, but I can't figure out where their school is, or I can't figure out how to get home. But I would have never in a million years thought he could do that to himself. And then I started having the same problems. Bad headaches, pressure on my skull. I couldn't see very well, I couldn't talk very well. All I wanted to do was lay down, because my head was just constantly pounding. The pain had gotten so bad where if I had had a gun, I wouldn't have been here. And these two doctors from New York called me and said, hey, we think we can help you. We think we know what's going on. I said, let's do it.
Jim was diagnosed with early onset dementia. He had been complaining about a brain fog, as he described it, as well as he described it, a headache where he felt like ice picking on both sides of his brain.
While most concussion studies are focused on the brain, McMahon's team traces the effects of CTE directly to the upper spine, having found that neck misalignment can block the flow of spinal fluid and pull toxic proteins directly onto the brain.
Spinal fluid is white. That's the spinal cord. This is the spinal column. What you're seeing is a narrowing of the opening where the spinal fluid is supposed to come through.
Most of the time when you're having head problems, that's all they look at is the head. These guys are smart enough to at least look below the head at the neck and see if there was a problem somewhere, and they found my problem. They're not going to be able to reverse the damage. Like I said, that stuff was sitting in there for 20 years. So how much it ate away in my brain, I don't know.
Using detailed images captured by the MRI scans, McMahon regularly receives targeted adjustments, clearing the blockage and restoring the flow of spinal fluid.
This instrument is going to generate a gentle mechanical tapping.
This is the instrument version of upper cervical care. We did this for 4 years. These instruments work great. There's a different approach, very gentle.
Okay. Then sit back up.
First time they did this procedure, within 2 minutes, it was like the toilet flush. I could feel the stuff actually leaving my brain. My eyes cleared up, my speech cleared up.
The left is before, the right is after. See the sound my is there? See how there's less in here? Instead of all this white stuff being there, you see more brain tissue than fluid. So it's already started to break. Over the next several days, it'll improve for me.
What damage is done is done. I can't reverse that. But what these guys do for me, they keep me from having these bad pains, having these suicidal thoughts, having me function fairly normally while I can.
It may have been hard to see from there, and I'll recommend go out to ESPN 30 for 30, put in Jim McMahon, you'll find the clip, and you'll see that there's less fluid on the brain immediately after the adjustment than before. So it's one of the most powerful concepts that I know about, and every NFL player, every athlete should have this procedure done. And you think about all the suffering and the football players on the backside of their career, early onset dementia, the violence, the suicide, and how much of that could have been prevented. And what's amazing is we always knew these mechanisms were happening with the upper cervical adjustment, that we had the ability to affect the brain, but now we actually have technology that can actually show those changes. And so my career almost didn't happen. I almost dropped out of chiropractic school. See, I played football for Manalapan High School back in the 90s. And back in the 90s, it was before we knew everything we know about concussions. We were actually taught to hit with our helmets, with our heads. They used to say, put your face mask in their numbers. And whoever had more scuffs on their helmet, you knew got more playing time. So we were all leading with our heads. And so by the time I got to undergraduate college, University of Maryland in the 90s, my neck wasn't right. It hurt to turn it. I had restriction in motion. And I actually thought that was normal. I remember asking my friends, does it hurt when you do this? And they go, no. And I was studying exercise physiology at University of Maryland, and I was looking at a career in either medicine or physical therapy. And a friend of the family was a chiropractor. And I spent time in all three professions, and I was really attracted to chiropractic based on its philosophy that you could help people get well without putting anything in or taking anything out of their body. I love that concept. And I went down to chiropractic school, and it was late 1999, early 2000. And I remember with my first quarter professor, I went in to become a patient of his because I figured, well, I'm going to become a chiropractor. I might as well get under chiropractic care and see if I can get some help. And I was getting the traditional type of chiropractic care, and for me, that care wasn't right. It's right for a lot of people, millions of people, but it wasn't working for me. In fact, I felt worse. And I remember feeling so conflicted inside that I would call home to mom, to dad, say, look, I think I've got to make a change. I think I have to transfer. I think I have to change careers. How can I bring this to market if it's not even working for me? I had all those questions in my mind, and I'm telling this story to this young lady, this young girl in my class in the hallway. This is the C building at Life University in Atlanta, and I'm telling the story, and she goes, whoa, 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 before you do anything drastic, go listen to this upper cervical doctor, Dr. Russell Friedman, speak on campus Wednesday night. And I was a student, I was open, I was there to learn, so I said, yeah, sure, I'll go. And I went to listen. I didn't even know what upper cervical was. And Dr. Friedman, who to this day is still my mentor, he didn't speak. He brought 6 of his patients to speak, and they told these miraculous stories like Jim McMahon or like Sarah or some of these other stories that you'll see on our website. And I was intrigued, but I was skeptical. I was from Jersey. You got to prove it to me, is sort of my attitude back then. And so I went in as a patient, and for me, it was very similar to Jim McMahon. I felt the difference almost immediately. And I sort of, it was almost a spiritual experience where like I just knew I felt right again and that I was supposed to be doing this work. And I asked this doctor, I said, can I come and shadow you? I'll do anything. I'll take out your garbage. And I went there every Tuesday for 3 years straight to learn upper cervical. And I was attracted to the science and the measurements. And he was seeing patients, and he still does, from all over the world and all over the country. And, you know, I think about this conversation that day with that young girl, that if she didn't say something, if she didn't care enough to say something, if she didn't have the courage enough to say something, I don't end up at that Wednesday night talk or finding this work or doing any of this. I mean, the career is accomplished. 17 years, 200,000 plus adjustments. I've trained 11 doctors. I now sit on the board for Dr. Friedman's techniques. I teach at the schools and at the seminars. And none of that's about to praise me. It's about to say the power of the spoken word to help somebody. And again, I said this 2 other times, this talk may not just be for you, it may be for somebody that you love or care about, and I'm going to implore you to share it with them and allow them to decide whether or not to try it on. And so B.J. Palmer, the developer of chiropractic, said, you never know how far-reaching something you do or say today will affect the lives of millions tomorrow. And to this day, I still don't know who that young lady was that led me in the right direction. And she doesn't know the thousands of lives that she touched with that simple recommendation. She literally was an angel that flew into my life. So again, I'm going to ask you if this makes sense to you, if you love this work, if it's working for you, if you care about those you love who are suffering or who aren't suffering yet. Why wait till someone suffers? We don't wait till our kids have tooth pain to take them to the dentist. That you recommend this care. And one of the things that I want to do for you, for making it to the end of this long presentation, I want to offer you a gift. If you made it to the end of this presentation, all you have to do is call our office, let us know whom you're going to be recommending in, and let them know I made it to the end of the presentation. That's going to entitle that person to a complimentary exam and x-rays in our office, if they're indicated, the x-rays. Consultation, full consultation, thorough health history, a complete examination, neurological testing, all of their x-rays. That visit is typically, like in most doctors' offices, several $100, $300-$400. We're going to do it complimentary if you or they mention I made it to the end of the presentation. That's all you have to say, because I want to reward you for taking the time to invest in yourself. It's a lot easier to just kind of click on, watch 6 minutes and say I did it, but you made it to the end. So all you have to do is say I made it to the end of the presentation. I want Mary, Jim, and Bob to get their exam and x-rays as a gift from me to them. Okay? So that's my gift to you and you to them. And I want to thank you for spending this time with me. We are 100% committed. That's why I am in my office by myself right now instead of being home with my family. Because I know that there's someone on the other side of this monitor that if they actually take action, health requires action, so you have to take action. And maybe it's you. Maybe you're not a patient yet and you need the examination and x-rays and you're going to call the office. You're going to go, I made it to the end of the presentation on YouTube or on Facebook, wherever you're watching this. And we're going to give you that complimentary exam and evaluation. So there you go. I want to finish with this video. Very powerful. Remember I said health requires action. So health is a choice. It doesn't happen to us. It happens because of us.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at makehealthlast.ca.
I remember being in Glacier Mountain National Park with my family on a hike, and we ran into a really nice man who was from Montana, and he had just finished up a 7-mile hike in the mountains of Glacier. And I asked him how old he was, and he said 84. 84, 7 miles that day in the mountains of Glacier. And so you can say, oh, he just got lucky, he got good genes. It's everything we spoke about. It's lifestyle, it's headset, it's activity level. It became the fabric of who he was. And it's never too late, no matter where you are, to change where you're going to be and who you're going to become. So thank you for spending this time with me. Thank you for allowing me into your home. If I'm already your doctor, if our team are already your doctors, thank you. We don't take that lightly. We don't believe doctor means big shot. We believe it means servant. And we are privileged and honored to be able to serve you. And so I put all of this into a book. And so however you want to share this with people you love, you can pick up your free hard copy of the book when you come into the office on your next appointment. Just ask us for it, or they're in the rooms. You can download this off of our website. There's a electronic version of it, and You know, these are many of the conditions or people who are suffering with conditions that were helped with upper cervical care. So again, thank you for your time. I look forward to seeing all of you in the office on your next visit. God bless and be well.